Hi, I'm Dr. Lamarche, a nephrologist. Welcome to this video series on advanced chronic kidney disease. This is the last of 6 videos. We recommend you watch all 6 videos in order. This video will compare the different treatment choices to help you decide what will work best for you. Subtitles are available if you need them. Just click on the symbol at the bottom of the video. This video is also available in French. This video will compare the different treatment options: peritoneal dialysis, in-center hemodialysis, home hemodialysis, kidney transplant, and conservative kidney management. We encourage you to think about what is or are the best treatment choices for you. Most of these choices need some preparation, and it is best not to leave this decision to the last minute. Good preparation lowers the risk of getting sick and having to be admitted to the hospital. We will now compare the different treatment options. I will go through 14 questions and answer them for each option. First question: how does the treatment work? With peritoneal dialysis, dialysis fluid is put into the abdomen and the peritoneal membrane filters the blood. This is done several times per day or using a machine overnight. With in-center hemodialysis, a machine cleans your blood. Treatment is done in the hospital or in a clinic. With home hemodialysis, a machine also cleans your blood, but treatments are done at home. With kidney transplant, a healthy kidney from either a deceased or living donor is surgically implanted in your abdomen. With conservative kidney management, your care team helps manage your symptoms. When needed, palliative care is offered. Where is treatment done? With peritoneal dialysis, it is done at home. With in-center hemodialysis, the treatment is done at the hospital or in a dialysis center. With home hemodialysis, the treatment is done at home. With kidney transplant, the surgery is done at the hospital, but you go home afterwards. With conservative kidney management, depending on your needs, at home or in a facility. Who will be doing my treatment? With peritoneal dialysis, you will be trained in a clinic for about 1 to 2 weeks. Then you or your care partner will do the treatments. Sometimes nurses do home visits to help. With in-center hemodialysis, the staff at the hospital or in the clinic will do your treatments, and you may participate if you want to. With home hemodialysis, you will be trained in the dialysis unit for 1 to 2 months. Then you will do your treatments at home. With kidney transplant, once the surgery is done, your anti-rejection medications will be adjusted by your nephrologist or the transplant team. With conservative kidney management, you will have support from your healthcare team. There is no dialysis. How often is treatment done? With peritoneal dialysis, usually every day. If you do the exchanges manually, it is typically done 4 times each day. If you use the machine, it will be done during the night. With in-center hemodialysis, the treatments are 3 times per week. Each visit takes about 5 hours. Also, consider the travel time to and from the dialysis unit. With home hemodialysis, the schedule is flexible. It can be 3 to 6 times per week, during the day or during the night, depending on your schedule. With kidney transplant, your new kidney is working all the time. You will take anti-rejection medications, usually twice a day. You will have regular clinic visits and blood tests. With conservative kidney management, at first, you will be seen by your nephrologist or your family doctor at regular intervals. When needed, you may also see the palliative care doctor and have home nursing visits. Do I need a surgery? With peritoneal dialysis, there is a surgery to put the catheter into your abdomen. You may be put to sleep, meaning general anesthesia, for the procedure, but this is not always the case. Speak with your healthcare team for more information. You will go home on the same day. With in-center hemodialysis, if you do dialysis with a central catheter, this is a short procedure and you do not need general anesthesia. If you choose a fistula or a graft, it is a surgery done in the operating room. You do not need general anesthesia and you will go home on the same day. With home hemodialysis, this is the same as for in-center hemodialysis. The procedure depends if you choose a central catheter, a graft, or a fistula. With kidney transplant, there is a surgery to implant a new kidney into your abdomen, under the abdominal muscles. You will be put to sleep, meaning being under general anesthesia for the surgery. With conservative kidney management, you will not need a surgery. How will I feel? With peritoneal dialysis, most people feel well because dialysis is done slowly. With in-center hemodialysis, some people feel tired after treatments. Some people have cramps, nausea, dizziness, or blood pressure drops during treatments. This can happen when excess liquid is removed during dialysis treatments. With home hemodialysis, if you do your dialysis over a longer period of time, there are usually fewer symptoms than with in-center hemodialysis. This is in part because the excess liquid is removed slowly. With kidney transplant, once you've recovered from the surgery, most people feel very well. With conservative kidney management, you will have symptoms of kidney failure. Your healthcare team will try to keep you as comfortable as possible with medications and other supportive care. How does life expectancy compare, meaning how long you will live? With peritoneal dialysis, the average life expectancy is similar to hemodialysis, but shorter than with a kidney transplant or than that of people who do not have a kidney disease. With in-center hemodialysis, the average life expectancy is similar to peritoneal dialysis, but shorter than that with a kidney transplant or than that of people who do not have a kidney disease. With home hemodialysis, the average life expectancy is similar compared to peritoneal dialysis and in-center hemodialysis, but shorter than with a kidney transplant or than that of people who do not have a kidney disease. Life expectancy may improve if the treatments are longer or more frequent. With kidney transplant, this option usually has the longest life expectancy. With conservative kidney management, the life expectancy is difficult to predict. In general, it is shorter than with dialysis. For some people, those with more health problems or who are older, life expectancy may be very similar to in-center hemodialysis. How often will I see the healthcare team? Please note that this can vary. With peritoneal dialysis, you will be seen in clinic about every 1 to 2 months or more often if needed. The healthcare team is available by phone during regular hours. With in-center hemodialysis, you will be seen by the staff in the dialysis unit every visit. The nephrologist will also see you at regular intervals in dialysis. With home hemodialysis, you will be seen in clinic about every 1 to 2 months or more often if needed. The healthcare team is usually available by phone during regular hours. With kidney transplant, you will be in hospital for about a week. Then you will be coming to the hospital at least every week, which will gradually space out. At 1 year after transplant, these visits are generally every 3 months. With conservative kidney management, you will be seen in clinic and you can discuss how often you'd like to see your nephrologist, family doctor, or palliative care doctor. What about my work? With peritoneal dialysis, most people are able to continue working. They adjust their dialysis schedule to their work schedule. With in-center hemodialysis, the schedule for this type of dialysis is not as flexible as other types. Depending on your type of work, you may be able to continue working. With home hemodialysis, most people are able to continue working. they adjust their dialysis schedule to their work schedule. With kidney transplant, most people are able to return to work about 3 months after the kidney transplant. With conservative kidney management, it is not common to choose this option if you are still working, but you can continue your activities as long as you feel well enough. What about eating and drinking? With peritoneal dialysis, you may have to be careful about the amount of fluid you drink and what you eat. With in-center hemodialysis, most people have to be very careful about the amount of fluid they drink and what they eat. With home hemodialysis, if you do longer dialysis sessions, you may have more freedom in what you can eat and how much you can drink compared with in-center hemodialysis. With kidney transplant, people with diabetes need to watch what they eat, as some medications can make their diabetes worse after transplant. Otherwise, you can eat and drink as you normally would. With conservative kidney management, when the kidneys fail, fluid and some electrolytes can increase in your body. How much you restrict your diet depends on your goals. Do I need medical equipment at home? With peritoneal dialysis, yes, dialysis fluid bags need to be stored at home. These are delivered about once a month and take up about one large closet. With in-center hemodialysis, you do not need any medical equipment at home other than a blood pressure monitor. With home hemodialysis, the hemodialysis machine is about the size of a medium-sized fridge. You will also need other supplies which are delivered about once a month. There will also be a water filtration system installed in your home. With kidney transplant, you do not need any medical equipment at home other than a blood pressure monitor. With conservative kidney management, you do not need any medical equipment at home. Can I travel and go on vacation? With peritoneal dialysis, yes. The dialysis fluid bags can be delivered to your destination, or you can transport them depending on the duration of your stay. With in-center hemodialysis, you can travel, but you need to plan ahead. You can arrange for dialysis to be done at a hemodialysis unit at your travel destination. Outside of Canada, there may be a cost for these treatments. With home hemodialysis, it is the same as with in-center hemodialysis. With kidney transplant, you can travel, but you need to wait a few months after your transplant. With conservative kidney management, you could be able to travel depending on how you are feeling. Speak with your healthcare team before traveling. Does this choice require needles? With in-center hemodialysis and with home hemodialysis, needles are required only if you have a fistula or a graft. A central catheter does not require needles. The other options do not require needles either, other than for blood tests. Can I take a bath or go swimming? With peritoneal dialysis, no, unless you are swimming in salt water or in a private chlorinated pool, but you can shower with your catheter. With hemodialysis, only if you have a fistula or a graft. A central catheter can never get wet. With a kidney transplant and with conservative kidney management, there are no restrictions. And that's a wrap. Feel free to go over certain videos or sections again and take notes. Take the time to think about which option suits you best. You may have more than one option you are interested in. Bring your notes and any questions you have to your next visit. Having chronic kidney disease and having to make a decision about your future treatment is not easy. There are support groups in the community that can help you. They are often run by kidney disease patients or their caregivers. Support groups offer information, support, and links to resources that may be helpful to you and your family. You can also visit the Kidney Foundation of Canada's website to connect with their support group. Click on the link in the description of this video at the bottom of the screen for more information. You can also pause this video and copy the link which is shown on the screen. You can also ask your healthcare team about support groups in your community. The Kidney Foundation of Canada also has many resources available to you. This link will also be available in the description of this video at the bottom of the screen.